Welcome to Thursday's edition of COVID-19. Following a surge of more than 100 infections yesterday, Korea's daily tally today dropped to below 70. Despite the numbers, though, authorities remain cautious ahead of yet another long weekend starting tomorrow to mark Hangul Day. We start the program now with the updates on the pandemic with our Kwon So-ah and with related news with our Kim Da-mi later on. So I do start us off with the latest numbers on the local front for this Thursday.
Sunny, just a day after we saw a surge by almost 40 cases, this Thursday we are seeing a plunge by more than 40 infections. So if you take a look at our graph, it shows us the development since October 1st. For 6 straight days, we were in the double digits, and then we had that jump to 114 cases on Wednesday, and now we are down to 69 cases, which tells us that it's too early to make predictions at this point, especially as we're less than a week back from the Chuseok holiday, which means in the following days or even until next week, we may see new emerging cases. So we will still have to wait for the figures in the following days. And there are also especially growing concerns about family transmissions following one cluster infection in Jeollabuk-do province's city of Jeongeub. We now also hear of family transmissions in the center of the country in the city of Daejeon. And that is also why we are seeing these 7 new cases in the city of Daejeon and also 24 in Gyeonggi-do province, 20 in Seoul and 5 in Incheon, as well as down there in Busan as well. And with that, Korea now has a total number of 24,422 infections with 427 fatalities. Around 1,500 people remain in quarantine with some 22,460 recoveries. And now let's take a look at the global figures. While the total caseload stands at a little less than 36.4 million, it looks like 1 out of 6 people are from Europe, according to a latest AFP tally. The continent hit 6 million cases on Wednesday with at least 237,000 fatalities. And if we take a look at the 10 worst hit countries around the world, let's take a look at Europe today first. Russia is the country with the highest infections in the continent, followed by Spain. In Latin America, meanwhile, Brazil hit the 5 million mark, and Argentina, meanwhile, has surpassed the cases in Peru. Let's take a look at other serious spots. Again, in Europe, France and the UK are still seeing daily cases above 10,000. And Sunny will connect to a journalist in London to take a closer look at the UK. Meanwhile, the Philippines has surpassed Turkey now with almost 330,000 cases. Italy, meanwhile, was said to have seen the highest daily caseload since April with over 3,600 cases in the past 24 hours. And those are the updates I have for now, but I'll be back with more after the government briefing. Sunny?
All right, so thank you for that. I'll see you back at the desk. Right, in related news, business travel between Korea and Japan has resumed despite the pandemic following a bilateral accord to ease movement restrictions. For more on the actual details of this accord, I have our Kim Da-mi here in the studio with me. Welcome, Da-mi.
Good afternoon, Sunny.
Right, now do tell us more about this fast-track entry arrangement.
So last year, before the pandemic, around 310,000 Koreans visited Japan for business purposes. But since March, no one has been allowed to travel there due to border restrictions. But starting today, Korea and Japan are allowing business travel between them to resume. Seoul's foreign ministry said Tuesday that they will create 2 separate tracks, one for business and the other for residents. Business people will be able to make short trips without spending 14 days in quarantine if they test negative for COVID-19 and submit the required documents. For those staying longer, they can travel on the residence track, but do have to self-isolate for 2 weeks.
With the latest agreement, we hope to engage fully in people-to-people exchanges with Japan, starting with business people. Japan is South Korea's 3rd largest trading trader and its 2nd largest partner in terms of movements of people.
Visitors, however, will be asked to follow strict disease prevention guidelines upon arrival. Business people arriving in Japan will have to download a tracking application on their smartphones, and they can only use private vehicles, not public transportation, and are not allowed to go anywhere that isn't a part of their business plan. Speaking on the phone last month, President Moon Jae-in and Japan's new Prime Minister Yoshihide Suga welcomed the progress made on this agreement, expressing hope that it can help advance bilateral ties. Aside from Japan, Korea has a fast-track entry agreement with China, the UAE, Indonesia, and Singapore. Japan had only reopened its borders to Singapore so far, making Korea the second country it has reopened its borders to. The deal was also announced by Japan on Tuesday. Business groups in Seoul welcomed the announcement, saying it will help businesses in both countries suffering from the impact of COVID-19.
Right. And speaking of business, Tami, I hear that prospects for Korea's economy among pundits overseas remain relatively solid.
Right. So Fitch Ratings has maintained Korea's credit rating at a AA- for over 8 years. And despite the pandemic, Korea's credit rating remains unchanged at AA-, the fourth highest ranking on its scale with a stable outlook. Korea has held on to the rating since 2012 when it was upgraded from A+. Which cited South Korea's steady economic performance despite challenges including North Korea and an aging society. It added that although the pandemic is weighing on the economy, Korea has managed to cushion its impact through robust policy responses. Though the level has remained the same for over 8 years, this recent affirmation is meaningful since a record number of countries suffered a downgrade in their ratings and outlook this year. Credit ratings for the UK and Canada have been slashed, while the US and Japan have received scaled-back outlooks.
We have been keeping the supply and demand of foreign exchange in a stable condition, although the country has seen a recession in trade surplus, and I assume they kept the ratings for South Korea, considering its asset market stability.
However, some experts suggest that although Korea maintaining its credit ratings is an encouraging sign, caution is still needed.
The fact that a global credit agency has assessed South Korea's economy in a positive way is meaningful. However, it's also true that some of their past ratings did not fully reflect the upcoming difficulties.
Amid uncertainties over the pandemic, Fitch forecasts the nation's GDP to contract by 1.1% this year. But this is still more of an optimistic forecast than the Bank of Korea's projection of a 1.3% contraction and the negative 7.1% average growth rate among countries with the same credit rating.
I see. All right, Tami, thank you for that coverage. I'll see you again next week.
Sure.
Right, we'll turn now to the regular government briefing on COVID-19 here in this part of the world. Just a day after recording three-digit figures, Korea's daily tally stands at below 70 today. But as emphasized earlier, authorities are bracing for possible rebounds as they point to the incubation period of the virus in yet another long weekend starting tomorrow to mark Hangul Day. Accordingly, the special safety guidelines imposed ahead of the Chuseok holiday remain in place until this coming Sunday. Now, these guidelines correspond to those under level 2 social distancing. Gatherings of more than 50 indoors and 100 outdoors remain banned, which is why authorities are vowing to take stern action against those who partake in rallies this coming weekend. Operations at high-risk establishments, including buffet restaurants, clubs, bars, singing rooms and cram schools of more than 300 people remain suspended here in the metropolitan region. Internet cafes, however, are allowed to open but cannot accommodate minors. They can serve light meals, though. Now, we are still waiting for the briefing to start, and perhaps while we wait, we can take a quick look at the numbers for Korea for this Thursday, as reported to us by our Kwon So-ah earlier. Now, Korea had a total of 69 cases today, raising the total number of infections in the country to 24,422. I understand the briefing has started. I'll come back to you afterwards.
First of all, we will give you a briefing on the press kit. Let us now begin our regular briefing for the COVID-19 response here in South Korea. As of October 8th, we have a total of 60 new local infections and 9 new imported cases. The total caseload now stands at 24,422. Currently, we have 1,532 people in quarantine undergoing treatment, and 97 of them are in critically ill conditions. And yesterday we had 2 more fatalities, and the accumulated death toll now stands at 427. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at the updates on our domestic infections by region. First of all, starting in Seoul City in the Tana Mental Hospital, we have 1 additional case being confirmed. A total of 51 cases have been confirmed to date. And in relation to a family meeting in Hwaseong City, Gyeonggi-do Province, we also have 5 additional cases, and a total of 6 people have been confirmed to date. And in Gyeonggi-do Province, in relation to a family meeting in Goyang City, we have 6 additional cases. In total, we have 7 cases being confirmed to date. And in Gyeonggi-do Province, Ujeongbu City, in relation to the Master Plus Hospital, we have 6 additional cases, and a total of 36 have been confirmed to date. And in relation to a Daejeon family meeting, we had the first case of the index K being confirmed on the 4th of October, and a total of 12 cases have been confirmed to date. And in relation to an acquaintance meeting and social gathering and a healthcare facility in Busan City, we have 2 additional cases. A total of 13 people have been confirmed to date. And as for the details of other cluster infections, please make your inquiry to the spokesperson's office at the ministry. And also, we will give you an explanation about today's imported cases. As of today, we have a total of 9 imported cases. Of them, 7 are foreign nationals. And as for the countries of origin, we have 1 from the Philippines and Myanmar, 3 from Indonesia, 1 from Poland, and 3 from the US. Today, we will also look at our measures to wash our hands thoroughly in order to prevent our infectious diseases, including influenza. And please note that washing of your hands is a very effective measure to protect yourself from any infectious virus. And even before we know, we are often touch our face with our contaminated hands. And even COVID-19 can also spread through the hands as well. And our agency have conducted a detailed research from the years of 2018 to 2019, and we have looked at how much people touch their faces, especially for the senior citizens. And for those aged over the age of 65, they touch their hands about 22 times per hour, and they include eyes as well as nose and their mouths as well. And as for the children, they also touch about 46 times per hour, and about 12 times their mouth and also their faces, including nose and eyes. If our contaminated hands come into contact with our faces, please note that you could be exposed to the infections. And we also have many sources of infection. For instance, if a person does not wear a face mask and if this person coughs, he or she may cover his or her mouth with the hands. And this means that the contaminated virus could also come into contact with other surfaces that are frequently touched, including doorknobs and table surfaces. And they could also spread to others. And if other people touch these surfaces with their own hands and also they touch their face accordingly, this means that the virus can spread even without direct transmissions. So likewise, we can see these kinds of silent spreaders and unknown sources of infection. So therefore, it is very important for us to wash our hands on a regular basis in our daily routines. Before we have an effective vaccine being developed, there is nothing more effective than washing of our hands. So we ask you to wash your hands more today. Thank you very much.
Right, that short briefing by Lee Sang-won from the Central Disease Control Headquarters. That was Thursday's afternoon briefing. What was the gist of his rather short briefing today, right, Swa?
Yes, well, today he mentioned how we are seeing many new cluster infections that are related to families as well as small gatherings. And that was a concern that we had already before the 5-day Chuseok holiday. And it looks like there are also many cases of infections at medical facilities such as hospitals. There is one hospital in northern Seoul that has a total of 51 infections. And also in Gyeonggi-do Province's Uijeongbu, 6 new cases were confirmed at a hospital there, and that raises the total there to 36. So hospitals as well as family gatherings are the big concern here. I spoke about the Daejeon case earlier. In Daejeon, there's also a dozen patients that is linked to a family or acquaintances. And we also had that other case in Jeollabuk-do Province's Cheongup. So we will still have to wait for the following days to see whether there have been more family transmissions over Chuseok, because many people did travel to their hometowns. And in the meantime, the official also mentioned some basic quarantine measures as well as hygiene guidelines. And actually, we are later in our program, we are actually going to take a look at those new health habits that you should abide by in this pandemic. And he mentioned that many people are touching their faces more than they think they do. And when it comes to people aged 65 and above, which is the age group that's really the age group that really has to be careful in the pandemic, 22 times they touch their face on average in a day, I believe, and probably more than that in a day. I don't have the exact figure right now, but when it comes to underaged, it's 46 times. So that really shows how younger children and also the elderly have to be careful with those basic hygiene measures.
Right, so thank you for that. I'll see you tomorrow. And in the meantime, I'll take a look. Oh, not tomorrow, actually. We'll see you on Monday, because tomorrow is Hangul Day.
Yes, Hangul Day. And that also means that until Sunday, the special quarantine measures will be in effect.
Right, thank you for that. We'll take a look at that report you spoke about right now then.
All right.
Right, like experts claim, we have picked up a number of health habits like the frequent washing of hands and the wearing of face masks, as well as the watching of distance. But there are a number of habits that we need to break to stay safe from the virus as well. Do take a look.
Major League Baseball, which kicked off its shortened 60-game season in July, adopted several new rules to prevent an outbreak of COVID-19. This includes a ban on spitting by the players and coaching staff in the dugout.
South Korea's professional baseball league are due to start.
A ban on spitting has also been imposed by the Korea Baseball Organization, as well as the K-League, the country's top professional football division. Spitting is a frequent habit among professional athletes, but has become a target of these new rules to prevent the spread of COVID-19.
침에는 바이러스 농도가 높은데요. 이것은 이제 다른 사람의 손을 통해서 이제 눈, 코, 입으로 만지면서 들어간다든지, 또 이제 작은 비말들은 공기에 떠서 수미터 떨어진 다른 사람의 호흡기를 감염시키는 사례들이 일어나고 있습니다. 그래서 이 침을 뱉는 행위는 다른 사람을 감염시킬 수 있는 위험한 행위이기 때문에 버려야 하는 습관이 되겠고.
There are other risky habits that we have to kick to the curb. These include propping your chins, rubbing your eyes, running fingers through your hair, and licking your fingers to turn pages in a book. Those who habitually bite their nails may be putting themselves at especially high risk.
If you're biting your nails, you frequently are introducing all different germs into your mouth, bacteria, viruses, all different things, because all of our nails can collect different organisms underneath them, especially if we, aren't washing our hands enough throughout the day, or if we have long nails. So that's why it's important to avoid not only biting your nails, but also touching your face and eyes and nose if you can avoid it.
Experts are also recommending citizens not to grow a large beard or a mustache. The CDC released guidelines for men on the types of beards and mustache which allow or don't allow a tight seal for masks and respirators.
I wouldn't characterize any beard styles as in and of themselves being dangerous. But what we do know is that certain beards can interfere with the fit of a mask. And that could be the issue, is that some beards are so bulky that the mask will not fit correctly, and that means it will not work as effectively. So if you had a long beard that extended down from your chin, you would probably have a mask that would be ill-fitting. It would not be able to to cover all of that area and have a lot of openings.
COVID-19 has also brought many changes to the way people eat, especially in Korea's traditional dining culture of sharing food, like eating stews out of a single pot. A survey conducted in May showed that many office workers here in Korea now avoid sharing meals with others during lunch hours. In response, the Korean government has launched a campaign to change the country's dining culture.
농림축산식품부는 국민들의 관심과 방역상 시급성을 고려하여 음식 덜어 먹기, 위생적인 수저 관리, 종사자 마스크 쓰기를 3대 개선 과제로 선정하였습니다. 국민들이 이를 실천할 수 있도록 식사문화 개선 홍보와 캠페인을 추진하고 있으며 온 국민이 참여할 수 있는 덜어요 챌린지를 통해 공감대도 확산하고 있습니다.
We must all do our part to protect ourselves and our loved ones from COVID-19 by remembering these do's and don'ts in our daily routines.
Europe's COVID-19 infections have topped 6 million, and among the countries worst hit is Britain, where a recent technical glitch failed to take into account some 16,000 COVID-19 cases, fueling much public concern. For more on this, I have Joanne Harris, a freelance journalist in London, live on the line. Hello, Joanne.
Good afternoon. How are you?
Fine, thank you, Joanne. I hear it's really early in the morning there. Now, Joanne, let's begin with this error in account that led to a record of more than 22,900 daily cases this past Sunday alone. Please tell us more about this.
Yes, this was the news of the weekend, that we found out that we had this 16,000 extra cases that had not previously been counted. We are told by the government it was a technical error, but the Daily Mail, which is one of our newspapers here, reported that actually this was a problem with an Excel spreadsheet, that they ran out of space on the sheet. So there was data in the Excel spreadsheet which was not being imported into the government database. The government told us that they have fixed the technical glitch, but it does raise more questions about the accuracy of our data and how the government has been handling the crisis, full stop.
I was actually going to ask you about that, Joanne. Because of the mishap, I understand that there is much public concern and public questions about the accuracy of the government's data so far with regard to COVID-19. Please tell us more about that.
Yes, the Labour leader who leads the opposition government here called the mistake an intergalactic case of intergalactic incompetence the other day in Parliament. Prime Minister Boris Johnson has played it down and said that actually this means that cases are where we thought they were anyway, which seems to be, it's a little odd given the severity of the pandemic. In July, we had a situation where cases were actually downgraded in number after they combined tests from the NHS and commercial tests. So we've had a situation where cases were rising and then cases fell, and now cases are rising again, and we had a big spike. And the contact tracing system is also being questioned about its accuracy and its efficiency. So generally, I think confidence is pretty low with the way that the government is handling things at the moment.
I see. Joanne, how are medical centers dealing with the recent alarming rebound in cases? And how is the challenge of tackling COVID-19 affecting the treatment of perhaps non-COVID-19 patients at major hospitals?
At the moment, we are told that hospitals are not in an emergency situation. At the moment, there are 400 or so patients who are on ventilators, which sounds like quite a lot, but we had 3,000 or more patients on ventilators in April. So it's still a big decrease from that. At the moment, there's about, I think, 3,000 patients in hospital with COVID-19, and that number is rising steadily each day. But hospitals are managing right now. However, we haven't yet got to the winter flu season. And I think that's where concerns rise, that people start getting ill with normal winter diseases, need to go into hospital, and maybe don't go into hospital. There's still more excess deaths at home than in hospital than you would normally see for this time of year. The government has, however, said that it is putting £150 million into hospitals for emergency care to get us through the winter, basically.
I see. Are flu shots being recommended there?
Flu shots are always recommended here.
Right.
You can get them from your doctors or a pharmacist. So yes, they are being recommended. And I think more people will probably get them this year because of COVID-19.
Joanne, do correct me if I'm wrong, but I understand that because of the caseload of COVID-19, patients looking to have simple surgery have to wait for months to get their surgery done at hospitals. Is this true?
They did delay some treatments, yes, back in April. I think that they've tried to get things more back onto normal deadlines now. There has been concern that cancer treatment has been delayed, but the NHS has always been good at making sure that if you have a severe illness, you need surgery on an emergency basis, that you get it. And that is still the case.
I see. What measures then, Joanne, are in place to respond to the resurgence in cases there in the UK?
We haven't had much new again. In a couple of weeks ago, we were told that you had to wear face masks in more situations. We're currently under a thing called the rule of 6, which means that you have to make sure that you don't meet more than 5 other people, indoors or outdoors. And that has been greeted with mixed reaction. People don't really understand the scientific basis for some of our rules. In England, pubs and restaurants have to close at 10 o'clock in the evening. But Scotland yesterday has said that they are closing pubs and restaurants across central Scotland for a period of a couple of weeks. It's called a circuit breaker, according to the Scottish Government. And that means that they want to just crack down on an increase in cases in Scotland. But the problem we have, of course, is that England, Scotland, Wales can all put in different procedures. So you moving around the country is difficult because you don't know what you're going to find if you go from England to Scotland, for example.
I see.
But mask wearing and social distancing remains important.
One final question, Joanne, before you go. How is the public there responding to the latest events?
I think we're all tired. Everybody in the UK is just tired. The government's handling has been so inconsistent. The messaging has been inconsistent. And we don't know what to expect from day to day. So it's quite difficult to know what you're going to have to deal with next week or 2 weeks' time. And I think fatigue is the main mood right now in the UK.
Right, probably a universal atmosphere. All right, Joanne, thank
so.
you, as always, for making the time to join us live at this very early hour in the UK.
Pleasure, thank you.
연휴 기간 동안 검사량 감소와 전국적인 이동량 증가에 따른 영향이 본격적으로 나타나기 시작할 것으로 예상되는 이번 주까지는 추세를 지켜볼 필요가 있습니다.
전국적으로도 감염 확산이 이루어질 수 있는 가능성이 있습니다. 더더욱 거리두기와 마스크 착용을 강조드립니다.
We marked an end to one long weekend this past week, and we are poised to usher in another starting tomorrow. That is Friday and also Hangul Day here in Korea. Now, given the presence of cluster infections involving families as a result of extended gatherings to mark the recently passed Harvest Festival, authorities are calling for extra public caution. For more, I have Dr. Yoo Byung-uk from Suncheon University Hospital. Welcome back, Dr. Yoo. And I also have Professor Ok Sara Shin from Korea University. Pleasure to have you with us, Professor Shin.
Thank you for having me.
Right, Doctor, you will start with you. After jumping to 100 cases yesterday, more than 100 cases that is, today Korea has recorded 69 infections. What are your thoughts on Korea's current COVID-19 situation? And also in your answer, could you tell us a bit about your recommendations for the measures to be implemented from next Monday after the current special safety measures come to an end on Sunday?
Well, since last week, I didn't care about the number. Why? These numbers show us sometimes we be shocked, sometimes we feel released, but these numbers are showing to reflect it to 2-3 weeks before our situation was. I told you many times, this is like the mirrors of our fast, not yesterday. So yesterday, the day before 300, today 100, doesn't matter. Why? You know, already 30 or 40% of the patients who are infected, but who are asymptomatics. No symptoms at all, but they can be infected, the other persons. But still on the corner in all over the nation, already we have the long holiday with Chuseok. The people are the move and spreading, so we don't know still how many people are infected exactly. But these days, because of the big difference of temperatures, getting colder, people are getting symptoms like the common cold, so worry about it. But also at the same time, they are so afraid of visiting a screening center to detect the COVID-19. So that's why the number show us and also help to make the policy go to which level of social distancing goes. But don't believe this number. Why? So usually 1 week or 2 weeks later, and then the incubating period of the COVID-19 is the characteristics. So we have to tell what exactly we did and we do successfully in Chuseok holiday, probably next Wednesday, Thursday. So additionally, in my personal opinion, in point of view, already many people don't care about social distance number. Who don't know, now the level 2, 1 doesn't matter because in the nighttime, already they celebrated, they do a lot. So already it's a regulation and law is breaking it, some part. But problem is, like this leaking in all the depends, it can affect the whole of a community. So in my personal opinion, the numbers doesn't matter. At least 1 week, we have to keep the social distancing level 2. This is my personal opinion.
Right, and the members of the public need to be a bit more wary then.
Yeah.
All right, Professor Shin, given this prolonged affair with the pandemic, there are some who are calling for a dual defense response to the situation by better protecting those who are at high risk and perhaps gradually exposing those who are at low risk in hopes of fostering herd immunity. What are your thoughts on this, and what is the feasibility of herd immunity here in Korea?
So first, let me just remind you about how herd immunity works. So herd immunity is achieved when a significant proportion of population in a community develop immunity to an infection so that the infection stops spreading. But given that we have only less than 0.1% of people being positive for COVID-19 antibodies, it's almost impossible for us to have this establishment of herd immunity in Korea anytime soon. And especially we are doing all this strict social distancing, it's not going to be easy for us to create large infection clusters taking place in a widespread manner in Korea. So furthermore, having these younger people form this herd immunity is quite a dangerous idea because it will pose a potential threat to high-risk group. It's almost like putting the elderly and immunocompromised people to be the frontline troops of war against the COVID-19, and we shouldn't let that happen. So I think the herd immunity for us is not a viable strategy available to us.
So it could actually be a dangerous gamble for us.
Right.
Professor Shin, you mentioned the coronavirus antibody, and speaking about that, authorities have conducted 2 tests so far, and they're talking about conducting a 3rd one to reflect the most recent outbreak that started in mid-August. What are some things to consider during this latest test for antibodies of the coronavirus?
Yeah, so I think it would be very interesting to see if this mid-August, outbreak, sporadic outbreak will contribute to the increased positivity rate for COVID-19 antibodies from the 3rd round of serological tests that will happen in October. Considering and also that we are seeing all these silent infections occurring since September, right? But as far as the accurate testing is concerned, I think that it will be essential to include large sample size, and also in October the KCDC has announced that they will include about 10,000 people for the test, and versus second time they only had about 1,400 people, so that's better than the second time. And also, I think it is important to have a wide range of samples collected from all different age groups, and also different social backgrounds or different economical backgrounds, and also all throughout the regions of Korea. But just keep in mind that these antibodies, we don't know how long these COVID-19 antibodies will persist in our body. And there are reports saying that these antibodies will diminish with the time. So I think it's important to do the routine antibody checkup, and also it's good to have the frequent serological tests in the future.
Right. Dr. Yu, starting from next Tuesday, that would be the 13th of October, those who fail to wear face masks at public venues may be fined up to 100,000 won. Now, granted, there is a 30-day grace period until next month. I hear the law also calls for specific face masks to be worn. Could you tell us more about the face masks that are being recommended?
Well, mask. So just cover your nose and the mouth, it will be enough. But we are specifically defined which one will be fine. So in Korea, we can call KF94, KF80, and the anti-drilling mask will be accepted. But there are some confused, is like valve shape. The valve shape in the thing, actually valve shape is prevented to inhale, but our drill lip can be going outside. So please be mind about the valve shape and the mesh shape and the scarf. So someone who wear the scarf means this for the patient, it's not for the use for the medicine. But there are some exceptions, less than 14 years old and incapable persons is the exception. But please wear mask properly, and you can choose the KF94, 80, and anti-drug one, please.
I see. Professor Shin, staying with the idea of face masks, of course, in the absence of a vaccine or a cure, health experts have said, especially those here in Korea, that these face masks may be one of our best defenses against COVID-19. Please take this moment to remind us about the role of face masks in protecting us from tiny particles.
Sure. So there's no doubt that facial masks can protect you from COVID-19 infection. As Dr. Yu mentioned, that there are different types of facial masks, and the protection rates for these facial masks seem to be a little bit different. As Dr. Yu mentioned, that KF94, this HEPA filter facial mask, can actually capture all these large droplets and aerosols. So it is the most efficient ones I recommend. And these masks, and there are reports saying that these filter masks can actually give you about more than 90% protection, whereas surgical masks can give you only 67% protection. But just to keep in mind that none of these masks are 100% perfect or 100% protective. And given that COVID-19 infections are now being considered to be transmitted via air transmission, we have to keep doing the social distancing as well as frequent hand washings and proper wearing of a facial mask.
Right. Professor Shin, earlier this week, authorities disclosed the results of quality tests that were conducted on flu vaccines that had been stored in temperature outside of the recommended range, of course. They claimed that these vaccines were still safe. Of course, they're planning to recall all of them. What are your thoughts on this?
So first of all, it's very unfortunate that, public's confidence over these vaccines have fallen quite a bit over this. And I think that this should never happen. The mishandling of vaccines should never happen again, and we should take lessons from here. As far as the most important values for vaccines are to have the safety and the effectiveness. And for the last 2 weeks, the government has done some series of quality inspections to make sure that if these vaccines in questions will be still potent, right? And the other day, KCDC has announced that these vaccines are actually okay in terms of safety, stability, and as well as efficacy. I mean, not efficacy, potency. But I think that there are still questions and concerns remaining regarding the efficacy of these vaccines. But unfortunately, we won't be able to know the efficacy of this vaccine until the flu season is over. So I think that the government should do the rigorous post-monitoring of these vaccines and also share the information with the public on whether there are any differences with other vaccines and if there's any side effects from these vaccines.
Right. Staying with that, Dr. Yu, so despite the words from the government, as Professor Shin has mentioned, there is quite a bit of concern among members of the public, but we still have to get our flu shots in order to ward off a possible twindemic, that is. What are some things to consider to ensure a safe vaccination this year?
Well, this year, first of all, please do vaccination. Please do. Because something happened, so sorry about it. So this is not only the matter with the government, also the medical institutes and the medical health care provider also, we did the mistake, because I believe this is showing us our real condition, the real world condition we did not well before, is show up in this time. But from now on, the government, also medical health workers should be open. Transparency and honesty is very important, which means now government announcing actually this vaccination against the flu is not live one. The live one, like a measles, is very sensitive of the temperature and outside. It's out of range of temperature. But these cases, like a car, and Korean car is when it made it, we are tested for the high temperature, dries, and the deserts. So, and then we are selling and export. The same thing. This is each vaccination we tested already, a couple of years already. So which means this is safe, I can tell. Among the temperature from the 2 to 8 Celsius will be good, but less than 0, this is more serious because it can be harm to the people who are vaccinated. But this time, I'd like to say, when anyway, government take back, which is suspiciously contaminated or exposed out of range, please do vaccination and believe that. But what the Professor Shin mentioned, so afterward the vaccination program, please show us the vaccine, each numbers have it, lot numbers has it, our identity can be matched for each other. So who can have the vaccination, came from where, which hospital or which institute, which producing from which manufacturers should be open for all, and then probably we'll be recover our path to this national immunization program.
Of course, such transparency, I'm sure, will serve to boost public confidence again. Professor Shin, very briefly speaking, we had a new jargon on our show this week, the multi-system inflammatory syndrome in children. I understand it's an immune overreaction, quite similar to the cytokine storm we talked about previously on our show. What is the difference between these two conditions, very briefly speaking?
Yeah, sure. So one of the major characteristics of COVID-19 disease is that it has diverse clinical spectrums. And the vast majority of patients actually have mild to moderate symptoms, whereas subgroups have a fatal symptoms. And cytokine storms, are the the reason why they have the severe symptoms. It's speculated that robust production of cytokines will recruit all these unnecessary immune cells, and that will bring all these amplification of inflammation that leads to organ failure. So that's how the cytokine storms work. And the multi-system inflammatory syndrome, MIS, you have mentioned, that happens in some children of COVID-19 infected, right? MIS is quite similar to cytokine storms in adults in that, these symptoms arise as a result of cytokine storms. that leads to severe collateral damage, right? But it's quite distinct from cytokine storms in that the onset of the symptoms are quite different. So MIS actually, the symptoms occur 2 to 4 weeks after the onset of COVID-19, even with the presence of COVID-19 antibodies. So that's very perplexing. And I think there should be more investigation into why MIS is happening in some children. But there are some reports saying that this disease might have something to do with the development of autoantibodies in these children. So I think we have to keep looking into how prevalent MIS is in children and if there's any potential therapies for these children.
So we still need more research then.
Right.
Dr. Yu, very briefly speaking, or perhaps pick one social distancing measure that you would highlight for members of the public to keep in mind during the upcoming long holiday we have starting from tomorrow, which is Hangul Day.
Well, we don't have a vaccine yet. We don't have prepared medication yet. So everybody say, wearing mask is the only way can prevent for us in 2020 now. So wear mask properly in the public. So everybody wants to free from the mask, me too. But wear mask only way can protect yourself and your family and this community. Don't forget, because already they forgot wear the mask. Already it's common in the young groups. But wear mask not only save your life, save your parents and save this country too.
Right,
Please.
Dr. Yu. Thank you for that, as always. And Professor Shin, thank you for being with us today.
Thank you.
Right, well, that brings us to the end of Thursday's coverage of COVID-19. As mentioned earlier, tomorrow, that is Friday, we usher in yet another long weekend to mark Hangul Day. So do seek to abide by the recommended safety measures, including the frequent washing of hands, the faithful wearing of face masks, as our Dr. Yu has mentioned, and the fervent watching of social distance. See you next Monday.